Nasty, you were talking about one of the most common problems for pregnant women, like lower back pain. But I know that many of us actually experience during the pregnancy, starting from the pregnancy, incontinence and heavily afterwards. Mm-hmm. So could you elaborate on this and explain why this is happening and what could be done? This is very uncomfortable.
Well, yeah, this is kind of a little bit hush level topic, although now these days you can find more and more about it. Just I will decode the word incontinence. Incontinence is basically losing involuntary your urine or also stools or air on exertion, so sneezing, running and so on. And 1 in 3 women in their lifetime at some point will have incontinence, so that's quite common. And it can start during pregnancy for obvious reasons. You know, the baby's growing, it's pressing on the pelvic floor, it gets overstretched. If woman doesn't do anything about exercising it, if she has sedentary job, you know, there is a little muscle atrophy going on, obviously the bladder, it will have and muscles, it will have hard time to support those inner organs, and therefore this urine leak can happen. In a very complex cases, also fecal leak can happen, but these usually might happen after great trauma after birth. So this can be worked on during pregnancy. I encourage women to work on this during pregnancy, and I also tell them that you might not, conquer it during pregnancy because baby is growing. There is more stress, but if you start to find these muscles, if you keep them in a certain tone, it will be much easier for you after the pregnancy to continue. And meanwhile, if it's a really uncomfortable situation to you, there are special pads, special things you can use just to avoid these uncomfortable social situations. Now, after the birth, the whole, the dragon gets loose. I would like to say that there is a so-called immediate post-birth incontinence, where women 1-2 days after giving birth, especially if it was a bit of a longer labor, it was a bit difficult, maybe a cut or a tear, and she loses her urine, she has incontinence, she's in sheer panic, she's like, oh my god, I'm peeing myself. It's very common to have it straight after birth, okay? And most often in a week or 2 it will get better. And you will get better. Most of the women will get over it. However, it might continue on, as I said, exertion. So jumping, running, sneezing. And this is something that has to be worked on, targeted, pelvic floor, deep abdominals, posture, lifestyle, and so on.
So there are some exercises that you can show right now which will help to work on those muscles who should keep their bladder and the whole thing inside.
Yeah. Yes, there the exercise that I will show you, they're more of a activation exercises. They're making brain body connection, finding those muscles. You shouldn't be scared of doing them straight after birth. I have done it myself. It's not like a full body workout. You're not doing yourself any harm. Just with the breathing, with finding those muscles, starting to be aware of them, and when your body heals, when you feel ready, you can work on it in a more dynamic way with a specialist, very much preferably.
And if there is somebody who went through C-section, could also experience inconsistency, or this is only for vaginal birth?
No, absolutely not. And I think this is the biggest myth I hear. I don't want to pee my pants, I'll do a C-section. In a short term, there might be a difference, okay, because obviously there is not this kind of pushing through of the baby. However, I would like to mention, if a woman went through the whole stage of labor and the baby was very low and maybe she was already pushing and the baby already stressed the pelvic floor, it already happened, she might go for emergency C-section. If it was a planned C-section, because we know that it's a cut through abdominals, and abdominals are the major synergist of the pelvic floor, major bodies, they're best friends, they work together. If they are weak, then pelvic floor will also weaken. So in the long run, all women, regardless of the mode of the birth, they need to work on their pelvic floor muscles in order to prevent or avoid incontinence, and a C-section will not 100% save you from this, no.
Okay.
As you've noticed, I talked a lot about pelvic floor and pelvic floor and pelvic floor. So what exactly I would like you to do? So this is your pelvis, this is your vulva, vagina, and anus. So this is the area we're focusing on. And the easiest cue just right into beginning for activating the pelvic floor is to think about your tailbone, that is here, okay? And on a breath out, you think about getting your tailbone in closer to your anal area. You pull it in. This will activate the whole pelvic floor area. Later on, you can make a contraction, the pull in a little bit deeper, and think about the middle area between the vulva and the anus, and then contract them all together. So basically what we want is a lift up, pull of the tailbone into the inside of the pelvic floor. Also, I would like to demonstrate you a very simple spine mobility exercises, because many mothers are suffering from low back pain and tension after birth and also in the first days with the baby. Very simple moves, taking into consideration that most our daily activities are happening in a forward and backward plane. So we don't rotate a lot, we just bend forward, we come up. It's very important to utilize all the movements. So here, a modified cat and cow, where you pull your tailbone in and then you go on the side with your pelvis and with the head. So basically, you're rotating your pelvis and your back and through your shoulders. Really give emphasis to every movement. Do not rush. Breathing in and breathing out. Here you can also do the stretch that was also shown in a pregnancy video. It's a great stretch for anyone. And if you're just in the bed, laying down, relaxing, couple of stretches you can do. Hands by your side. Keep your legs together. Rotate them to the right, head to the left. You can stay there. A couple of nice deep breaths to open up the sides. And then you go to the other side and open up the other side. You can do this every day, several times a day. They're really safe and quite effective. I hope this will save you a lot of back pain.